Now we are going to describe the inferior aspect of the skull or the base from outside. From before backwards, the base consists of the bony palate and the alveolar process in the most anterior part, and the occipital bone in the most posterior part, while in the intermediate area, the skull consists of the occipital, the sphenoid, and the temporal bone. This is the bony or hard palate. It forms the roof of the mouth and the floor of the nasal cavity. It is formed by the palatine process of the two maxillae in front and the horizontal plates of the two palatine bones behind. Just behind the incisor teeth, there is the incisive fossa, through which the nasopalatine nerve passes from the nose to the palate. The posterior border gives attachment to the soft palate and presents the posterior nasal spine in the median plane. At the posterolateral angle of the hard palate, there is the greater palatine foramen, which is the lower end of the greater palatine canal, reaching up to the pterygopalatine fossa and transmits the greater palatine nerve and vessels. Just behind the greater palatine foramen, there are one or two lesser palatine foramina that transmit the lesser palatine nerves and vessels. The alveolar process arches around the hard palate and carries the sockets of the teeth, which are arranged on each half of the process as follows: 2 incisors, 1 canine, 2 premolars, and 3 molars. The most posterior end of the alveolar process is a tubercle called the maxillary tuberosity, which gives attachment to the superficial head of the medial pterygoid muscle. The nasal cavity is continuous with the nasopharynx through the choanae, which are the 2 large posterior nasal apertures. They are separated from each other by the vomer, which forms the most posterior part of the nasal septum. Each choana is bounded laterally by the medial pterygoid plate. The vomer lies on the undersurface of the body of the sphenoid and has an ala on each side. This is the pterygoid process with its 2 plates, the lateral pterygoid plate and the medial pterygoid plate with the pterygoid fossa in between. Tracing the medial pterygoid plate upwards, you find that it splits to form the scaphoid fossa for the origin of the tensor palatine muscle. While proceeding downwards towards the hard palate, you come across a hook-like process called the pterygoid hamulus, to which the pterygomandibular ligament is attached. Note that the lateral pterygoid plate gives origin to the lateral pterygoid muscle from its outer surface and to the medial pterygoid muscle from its inner surface. This is the basilar part of the occipital bone that extends from the foramen magnum to the body of the sphenoid bone, which lies under the vomer. In young age, the basilar part is united with the sphenoid bone by cartilage, which ossifies by about the 25th year. Immediately in front of the foramen magnum, the pharyngeal tubercle is found. It gives attachment to the median raphe, into which the constrictor muscles of the pharynx are inserted. On each side of the basilar part of the occipital bone lies the petrous part of the temporal bone, which fills the angle between the basilar part medially and the greater wing of sphenoid laterally. Lateral to the petrous part, you find the squamous part of temporal bone represented by the mandibular fossa and the articular tubercle. So, from medial to lateral, observe the following bones: basilar part of occipital bone, petrous part of temporal bone, greater wing of sphenoid, and squamous part of temporal bone. Behind the squamous part of temporal bone and continuous with it is the rest of the temporal bone, which comprises the tympanic part, the styloid process, and the mastoid part. Coming back to the petrous part of temporal bone, observe that its apex is irregular and separated from the basilar part of occipital bone and the root of the medial pterygoid plate by the foramen lacerum. Lacerum means irregular and lacerated. This foramen in the living condition is closed by a plate of cartilage. The medial border of the petrous temporal comes in contact with the basilar part of occipital bone, and if you follow this junction posteriorly, it leads to the jugular foramen. Just in front of the jugular foramen, spot the carotid canal. Note that the jugular foramen lies between the petrous temporal bone and the occipital bone, while the carotid canal is in the petrous temporal bone itself. The jugular foramen transmits the internal jugular vein, the inferior petrosal sinus, and the three nerves, namely the glossopharyngeal, vagus, and the accessory. The carotid canal transmits the internal carotid artery, surrounded by sympathetic fibers coming from the superior cervical sympathetic ganglia. The lateral border of the petrous temporal comes in contact with the greater wing of sphenoid, where the groove for the cartilaginous part of the pharyngeal-tympanic tube lies between them. Tracing this groove posterolaterally, it leads to a bony canal that enters the middle ear, also called the tympanic cavity. This bony canal transmits the bony part of the pharyngeal tympanic tube and the tensor tympani muscle above the tube. The horizontal part of the greater wing of sphenoid shows the foramen ovale, close to the lateral pterygoid plate. It is oval in shape and transmits the mandibular nerve, in addition to the lesser petrosal nerve and an emissary vein. Behind the foramen ovale lies the foramen spinosum, so called because it lies just anterior to the spine of the sphenoid. The foramen spinosum transmits the middle meningeal artery and the nervus spinosus, which is a meningeal branch from the mandibular nerve. The spine of sphenoid is related to two nerves, the auriculotemporal nerve laterally and the chorda tympani medially. The styloid process is encased laterally by the tympanic plate of temporal bone. Just behind the styloid process, between it and the mastoid process, there is the stylomastoid foramen, which transmits the facial nerve. This nerve supplies the muscles of facial expression. The mandibular fossa is for articulation with the head of the mandible, immediately anterior to the tympanic plate. In this fossa, the tympanic plate is separated from the squamous part of the temporal bone by the squamo-tympanic fissure. The medial part of this fissure transmits the chorda tympani as it comes out of the tympanic cavity to join the lingual nerve in the infratemporal fossa. The articular tubercle is an elevation just anterior to the mandibular fossa, and both of them articulate with the head of the mandible to form the temporomandibular joint. Medial to the mastoid process, there is the mastoid notch that gives origin to the posterior belly of the digastric muscle. Just medial to the notch, there is a groove for the occipital artery on its way to the back of the head. This is the foramen magnum. On each side of the foramen magnum, there is an occipital condyle for articulation with the upper surface of the atlas to form the atlanto-occipital joint, where slight flexion and extension of the head are allowed, but no rotation. Rotation takes place at the atlanto-axial joint between the atlas and the axis vertebrae. Just above the anterior end of the occipital condyle, spot the anterior condylar canal, which is called the hypoglossal canal because it transmits the hypoglossal nerve. Sometimes you find a small foramen just below the occipital condyle and is called the posterior condylar foramen that transmits an emissary vein. Behind the foramen magnum, there is the external occipital crest, which extends as a median ridge from the foramen magnum to the external occipital protuberance. It gives attachment to the ligamentum nuchae of the neck. About midway between the foramen magnum and the external occipital protuberance, you find the inferior nuchal line, which extends laterally on each side, parallel and below the superior nuchal line. The muscles of the back of the neck are attached to these lines and the area in between them.